So, I mean, this is not only for this procedure, for any procedure. Whenever I perform the procedure, I make sure my gadgets are there. So you can see in the video it was plastic one, but not they have replaced it with the metallic one. They think it works better.
Thank you.
So this is the IPC. Okay, so this is the IPC. So this is the introducer. This can be removed, pull out, and this is the cuff I was talking about. So this is a pro-fibrotic cuff, and this is a silicone material. The question about pigtail versus this one is, can you see big difference? So this is made of special material which can stay in your body as long as you want. Okay. This is the one-way valve. So there is a process. No air is going in or coming out. This is a one-way valve inside here. Okay. So this is the IPC kit. And can you see on the here? So there are holes everywhere. Okay. Two kits. Obviously you want to put it all of it inside, and whole of this part will be in the lung, at least this one. So that's why it looks much bigger than usual chest drain on the chest X-ray. Yes. I think it's buy one get one free. And sorry, the space is not that great, but okay. So I try to get everything in order. So this should be going from here somewhere, like something. Yeah, we can manage that. So there's your guide wire. Obviously this one. This one is just for drainage. I will leave it for the time being. You don't need it. We have got all these syringes and everything inside. Guys, can we have some water? Just to pretend that I'm putting local anesthesia. Okay. So this one is just to put it in to give it a bit straight. This one is a very floppy thingy as well, you know. So this one here, you put it in like this and do it. No, you can't remove it. Okay. So it just moves like this. Okay. Here, here, and here. Okay. So these are clicks. Can you see those two shoulders over it? So you can just put it here and do it. Okay. When you're moving, obviously you move it like this. So you can. So that's your. Usually we don't need this. So this is the separator which I was using, and in the video. I think these they have put extra for you guys to use later on. Okay. So I can create this one separately for you. So this is your introducer needle. In any pleural procedures, if I can say, if it's a thin patient, please don't put whole of it in. Yeah, it will puncture the lung. And this is 1 centimeter each. So I need these, and this is the cap which I will put. For example, you are initially when I put the IPC, I will attach it with the bottle, even normal bucket when the patient is in, so that we can remove it. That's much cheaper than suction bottle. I'm not using suction bottle in the hospital to make it cheaper. Yeah, already underwater seal. So when you have removed that from underwater seal, you want to cap it. So this one comes as extra. You leave in the notes of the patient. Okay. So when you are capping it, for example, you have put the normal one when patient is going home. You take everything off and you put this one at the end of it. I'll show you. This one is the connecting tube with the valve. So can you see that some of the bottles don't go? I mean, ours one, for example, we put it here. This one here. This one is just a sheath, and this is the connecting with this one. Can you see that? Yeah. So once you go in from here, yeah, and click, it's clicked. Okay. Now you can put, for example, your syringe at the end of it. If you want to see if fluid is coming, you will come out. Want to control it? This is your stop button. Okay. So let's take it away from the time being. Okay. So what else we need? Okay, and obviously you need a stitch at the end. So I use my own stitch technique. I mean, everyone has got their own. I mean, I don't mind whatever you use. Obviously you need this one. And is there any bucket or something we can put all these unnecessary? I mean, they are not unnecessary. They will be used for you guys. Don't use it. If you want to avoid the pinprick injury, okay, give me one. Give me one more from here. I'll show you now. So once I have used it, okay, I put it in here. I can't take it out anymore now. It's gone. Is a needle cutter or dispose? It's gone basically. No, I will throw it this one away with this. It is a fancy thing. So these types of things should be removed to make it cheaper. Okay, so let's start the procedure. Did we get water? Yes, we did. So you have got 2 syringes. Oh, where is the other syringe going? Did I throw it away? You've got 2 syringes. So I'm very generous with lignocaine. I use 20 ml of lignocaine, 1%. The volume matters more. Don't use 2%, please. Yeah, some people use 2%, and
I think we have to.
I think you should look for getting 1%. Let's say this is your local anesthesia. Okay. Good. There they use pigs, obviously. Here we use bird. And so this is the course I run in Leicester regularly. So I teach teach people there. That's why I have a good idea what to use here.
How much this course cost in UK if somebody wants to do?
It's not that much really. I mean, if you want to come, I can get it free for you from some pharma or something. आने जाने का खर्चा आप खुद कर लीजिए.
No, when we go on vacations.
So it's once a year. So you have done the ultrasound. You know where you are going. Okay. You feel the intercostal space. Okay. So wherever you want to go. So I use the end of this one. So I make 2 marks. Okay. Here. 1. हाँ जी, intercostal space में.
Same space ना?
Same space में about 5-6 centimeter. ठीक है? जो भी चीज़ आप use करना चाहें, as long as you mark it. ठीक है जी? You mark it. उसके बाद you give local anesthesia obviously to the skin here and make it bleb. Okay? Because that's where you will be working. And similarly here, 2 places. Okay? Make a bleb 2-3 centimeter. Okay, so first of all, I will go with green needle. I want to know there is a fluid or not. So obviously here there will be nothing. I go in and I aspirate. There is air coming out at least. I'm in the pleural cavity. Okay, so I'm sure I'm in the right place now. Okay, so that is the first step. Is there any pot there? I can put my shops there. I don't have surgery. Okay. Now at this stage, I will take my scalpel, and obviously in the same intercostal space about here, about there. Yeah, about.
Just skin cut.
हाँ जी, skin. ठीक है. And after that, now the video was slightly different. I do slightly different from the video because I created track right in the beginning. Okay, I don't want that wire hanging around here and there, and I do everything ready while the wire is in. Okay. So from here, obviously, you lift it up. हाँ जी, बहुत आसान. हाँ जी, लो जी. This is the track.
एनेस्थीसिया तो पूरा हमने क्या पूरा फिर ट्रैक
ट्रैक में भी दे दें. हाँ, सॉरी मैंने वो नहीं दिया. वो आप ट्रैक में भी देंगी यहाँ पे ना.
वो वीडियो में भी ऐसे
तो यहाँ पे आप ट्रैक में भी दे देंगे. ठीक है. तो देखें यहाँ पे मैंने आपको जल्दी में ये सारा आपने 20 ml यूज़ करना है वहाँ पे ना. तो अंदर जब जा रहे हैं तो यूजुअल प्रोसेस लाइक यू डू चेस्ट ड्रेन. I mean there is no doubt you will give in, you will give around the pleura as well, everywhere. Yeah, it's painful. Everywhere. It's a chest drain at the end of the day. Yeah, it's a chest drain. हाँ जी, that's not a problem. No, some people even don't use this. Some people just with this one you can create a track. Just with this one, it's not a problem. And usually when you give anesthesia from here, I can demonstrate it. So it will separate the skins, and that helps you as well from the fascia. So when you are going in from here, can you see? So they're separating the skin as well, like this. Yeah. So that helps. Obviously, like any local anesthesia, this is a local anesthesia technique.
Distance in CN से कितना होना चाहिए?
5 centimeters. No, I will not do too little. I will not do too much. Why not too much? When I'm removing it, I will be really in trouble if I do more than 5-6 centimeters. Okay. now I'm going into the space. So this is the introducer needle. So let's say I assume that this is the anterior of the patient, okay, and this is the posterior of the patient, okay. Let's assume here, okay. Obviously, where you want the tube be coming out, from here or from here? From anterior. Why?
Easy to
Patient can access it. If it is coming from here, patient how can access it? Yeah. So the exit part should be anterior on the front. Okay. So that's why I am going into the pleural space here. Okay, and it will come out from here. Okay. So here again you have made sure that fluid is coming out. Immediately put your thumb here. Obviously you have an assistant at that time as well. Here you put it in. This is guide wire. This is a Sendinger method, and on guide wire there are marks. Okay, so one mark is 10 centimeter. 10 centimeter going in, 20 centimeter. I don't think, unless it is an obese patient, I will go further. Otherwise, it's okay. Okay, so here I'm in. I've done that. Can you see in the video they did the track now? I have done the track already. Okay, there is a difference for video. I don't.
Yes.
The guide wire can come out, is hanging there, unsterile, etc. etc. Okay. Now at this stage, I will get everything ready. Okay. I will put it in. Obviously, I will ask my assistant to hold it. Okay. So guide wire. Okay. Can you see it has come out already?
Yes.
So hold it. Come out all the time. Can you see that?
Yes.
So can you see the cuff? Obviously, your incision should be enough that cuff can go in. You know, not too much, not too little. Now, my technique is obviously at the end of the day, I want it to be here.
At the edges.
Okay, at the edge, so that when I'm going to remove it, I want to separate it. But when I'm putting it in, I put it about at the end here. I'll tell you why later on. I have put it here. Okay, so now everything is ready here. No. So this is our introducer sheath. Yeah. So I have put it in here. Okay. So you always put your thumb here. Okay. So you go in. It has gone in. Okay. And then en bloc, you remove everything out from here except that here. Okay. In this meanwhile, fluid will gush out. Okay. Fluid will gush out in this scenario. Now I ask my assistant to give me this. Okay, I'm putting my thumb in, and now I'm putting it in. Okay, so I'm putting it into the pleural cavity. Hanji, aram se. If it is not going in, you can put some jelly, sterile jelly in it. Yeah, it will make it smooth.
Peel it off.
So it's going in. Easily. Have they removed the lung? There is a bit of resistance. I think they have not removed the lung from inside or anything. But it doesn't.
Lung has collapsed.
Yeah, lung has collapsed or something. Obviously. So at this stage you peel it like this. Okay. It's going in. It's going in. At the same time you keep on peeling. At the same time you keep on putting it in. Obviously you don't want to peel it off until it is all in. Okay, so I think I'm finding some resistance because some heart or lung is still inside. Or it has gone in. Great. So at this stage, I will remove everything. Okay. Now, at this stage, sometimes it is a bit kinked. That's why I put the cuff here. Now I will.
You can pull it
remove
back.
it. Oh, it is already. So if it is here, I will remove it to bring it here. So if there is any kink, it gets सीधा हो जाएगा. And then now it is in. Basically, it's all nearly done, finished. Now here, you want to check whether it is a no. You put this one here. Here is blocked, obviously, and you take this one, attach it here, and make sure fluid is coming out. Now you are in. Have you got more stitches, guys? I've got a bigger stitch. I usually use 0, 1, 0. This one is a bit small one. So here you have to close 2 wounds now. Okay. So obviously this one I put 2 stitches. Now make sure you don't take the tube with it.
Especially silicone.
there is one case report I'm going to publish very soon. Is when one of the IPC fractured inside the pleural space. I don't know why. Someone must have, when they were putting, they must have cut it. I mean,
Come to know about it.
oh, when I removed it, I looked at the CT scan before, and it didn't come out. Half of the things, when I pulled it out, it just broke. I thought it's broken, but when I looked at the CT scan previously, it has broken already because it was not draining. That is the first ever case in the world. Never happened like this. I've asked everyone. So that's why most probably whosoever put it, they may have made a nick, or there was a problem with the. But I don't know. I can't explain that, but we'll publish it.
हाँ उनकी क्वालिटी में खराब नहीं हो सकती.
So obviously you put 2 stitches here. So this one should be in.
इसका पर्पस सिर्फ क्योर करना है.
इसका तो बस wound हमने बंद कर दिया. Now next one is more important. Obviously you need 2 sutures for this purpose. So for any chest tube, I always put 2 sutures. So from here, obviously this fibrosis process will take 1 week, 2 weeks to hold it itself. In the meanwhile, I want to use these sutures to hold this. IPCs fall. If they fall on the floor, you have wasted 200 pounds. So that's why whenever I teach, I'm very particular about stitching technique. And put one more suture, please. So here, please don't deal with them as you deal with the big 32 French tube. These are very delicate. Okay. So when you're going to score it, just a little bit dent. If you do too much, it will block. Pinch हो जाएगी.
जब ये रिमूव करेंगे रिटेंशन फ्यूचर नहीं छोड़ेंगे
नहीं.
क्या दोबारा
No. So after 10 days, these sutures will come out. The nurse at home, they will remove the suture of the patient. Full stop. And then this cuff is holding it in place. So obviously I do it 2-3 times around it like you do with any chest drain. Okay. I will leave it here, and then similar suture I will do on the other side. This is in place, and this one is working.
Finished.
Now, just to show you, let's say you have attached it. Obviously, we don't have the usual bucket which we attach it with. We don't here, do we? Or I can show you this one. Okay, why not I show you with this one?
इसको जिन्होंने पैक कर दिया था
I will show you that one as well. There's a technique for that. So this is the section. I think this section should be closed already. Yes. So they may have removed it. Obviously, I mean, it doesn't matter because there's no fluid there, and so this one comes as packed and everything. So this one is a connector only when you are using it in the hospital to attach with the bottle. So that's how you will attach it. Okay. So this one comes out. This one comes with it. You attach it with this one. You see, it goes in. And here, now, this is the button to control the suction, and this one is the level of the suction. Okay. So at this stage, you just obviously clean everything, put gloves and everything. Here, this is suction. You press here, fluid will come in. Can you see the hissing sound? That's the vacuum. Okay.
You can use the pleura vac as well.
Sorry.
The pleura vac as well for the suction.
No, it's a special.
It is this is special one.
Not with the regular chest tube.
No.
You use another one, or you just leave it. We usually we drain 500 ml. Discard it. Oh yeah, discard it. Disposable. Everything there's extra with it. So when you have taken everything out, this one goes at the end of it. Okay. So you clean it with the wipes which you have got, and you put it there. Okay. Now here, you put it like this, and you put it this. Okay. Obviously, you ask your assistant to hold it. Now, have you got these sticking? This one. Okay. So one thing which I teach my juniors very much is, some people put this one directly over it. Wrong.
तस्वीर में भी उन्होंने ऐसे दिखाया ना वीडियो में
That's wrong. Why?
निकाल क्योंकि ये नीचे पर
स्टिक हो जाएगा.
That's a very good question. Because one of my patient, he did that like this. And then
you cannot separate this.
then he couldn't separate. Then he started using scissor to separate it and cut it. Okay. So that's why I always say put some gauze over it. Yeah. And ask your assistant to hold it. And then this one even says number 1, which one you are going to remove. This is for patient use, you know. Number 1, 2, 3. Which one you are going to? So you hold it here. So number 1 comes out first. And then it says number 2 will go. This is for patients. Number 2. This is number 2 as well. And then number 3. This is number 3.
हमारा सारा जुगाड़ पे काम होता है.
Jugaad is bad in interventional pulmonology. You may have listened to my lecture on cryobiopsies this morning. Yes. The person tried to do Jugaad in America and they killed the patients. So that's it. Basically, patient going home. हाँ जी, उसके बाद we do Monday, Wednesday, Friday. So when you are going to do it, you take it off. This thingy, this one with gloves, with sterile pack, this is a separate pack. Okay, this will come and the patient or a person will just take it off. We can peel it off easily. This one is disposable, gone. And with connector, you attach it and drain it.
So why don't we call the patient in hospital and attach the normal chamber drain and apply suction?
That
ये
may
जुगाड़ है
work
ना सर?
for you.
This is a जुगाड़ we can do.
But in NHS, the most expensive bit in the hospital is me. They have to pay me to see the patient. They don't want to do that. They want to get cheaper. Our nurses are very much well trained.